Enough is enough. Enough is enough. Enough is enough. We want better service. We want 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 service. Enough is enough.
What's actually bringing me here today is my wife that passed away like 2 weeks ago, man. My wife was actually a country case lupus arthritis patient that I was monitored for the last couple of weeks, months actually. I was living very close to her, man. And on the 16th, I bring my wife to the hospital for treatment, you see. At the 17th of June, the doctors at 2 o'clock past 2 in the morning, they called me, they told me my wife died, you see. So my wife died in this hospital because why they didn't treat her right. They didn't give her the right medical treatment as she was needed, man. Because why? When I put in a grievance against them, they called me, they told me that when they triage my wife, they triage her like a code yellow patient, not in danger. But my question is, how can you treat my wife as a code yellow patient if you didn't do a full triage, man? You didn't do a proper blood pressure test, man.
Okay, I was here last night on the 29th. I arrived here at Wesfleur Hospital around about 8 o'clock because I'm ill, and I was sitting here, and around about 10, between 10 and 11, they do the observations for me, and I'm still here waiting. I didn't see the doctor yet now. Don't even see the doctor, and it's around about 10 o'clock this morning. I sat here all night. For me, I must sit because I'm sick, because this is the only day hospital. And the other thing is, we consult this morning with one of the nurses. The nurses mentioned to us that the doctor will help us around about 9, 9:30. It's almost 10 o'clock, and we still sit. And there's a lot of people inside.
It's people waiting here for 2 days, and still also not getting proper health care. I don't know if it's there isn't enough nurses. We really don't know. It's from long waiting hours to, like I said, no proper health care. The attitude of some of the nurses here, some of the security guards here, also not wanting people to go in, but then it's people that's actually an emergency and they won't let the people go in. So there's a lot of challenges here. Okay, they come at 4 o'clock here to have, I think it's also doctor's appointments, but they arrive here much earlier, just so that they don't sit here the whole day.
But they end up sitting anywhere they long.
Yeah.
This is not an isolated case. One is that the issues with this regarding to the Wesfleur Hospital, it's been there for years, more than 10 years. If my memory serves me right. We've been addressing the issues of the lack of medicine lack of medicine and how patients are being treated. Myself, during 2015 addressed the case, or 2014 addressed the case when an elderly woman died in a wheelchair because she was not given the necessarily attention by the staff. Now, we are not saying that all of the staff or the doctors or the management should do a perfect job, but we're saying that there should be detail or attention for detail when it comes to the aged, especially the aged and the frail, and that is lacking currently in our district hospital in Atlantis.
So at this stage, the improvement plan that they worked is not as satisfactory that we can be able to deliver. So what I've asked them to do is they need to rework on it so that when we go back, and now I think that will be towards the end of July, we deliver something of the improvement plan, because it will always be the case when they've got a high number of service pressures of the people who are sick. Plus also I committed that not only for the health committees and the hospital boards in that area, but also for the staff province working with the city staff to see in terms of reviewing also their packages, but also have a public meeting. I said to the ward councillors that in your own ward public meetings that you do, just make one of them, even if you combine the whole of them, the Atlantis positives for 2 wards. But anyway, the facility is offering for the whole of them, up to the Mamre, the Pella, and all other areas. Even to have a public meeting engagement where we are providing them what is the improvement plan.